So this will be the knee circuit portion. As you're lying on your back, make yourself comfortable. Maybe a pillow underneath your head if you need one. If you don't, it's fine to be flat. And bend both of your knees. We start with core activation of the abdominal muscles through deep, long exhalations. Take a breath in. Your abdomen expands. And as you exhale, draw your belly in. The first part of exhale can be without any effort. And then continue. So you make it longer than normally. Longer exhaling, as if you were delivering a long Shakespearean line, and you keep speaking and you're still exhaling. When you get to the bottom of it, stop, swallow, and then inhale. For some of you, it will be 20 seconds long, 30 seconds long, maybe even more. For others, maybe 4 or 5 seconds. That's okay. Take a breath in, and as you exhale, make it prolong. And start drawing your belly in, lifting the pelvic floor up. Exhaling. The waistline is getting more and more narrow, and keep on exhaling, pulling your belly in. Stop, swallow, and then inhale. Relaxed way. Again, take a breath in. As you exhale, prolong it all the way down, exhaling, emptying your lungs, all the way, drawing your belly in, pelvic floor up. Stop, swallow, and then inhale. Great. And we're moving to the next. Straighten your right leg. If it can completely straighten, wonderful. If it needs a little towel underneath or small roller under the knee, it could be fine too. And we tighten the muscles of the front of the thigh. That's called quad set. Tighten by pushing the back of the knee into the roller or into the floor. Feel the muscles in front of the thigh tighten, and then release them, relax them. And again, tighten the front of the thigh, hold it for a couple of seconds, relax them. None of the exercises should be painful. If you find that some of them are hurting, skip them. See if you can do something to modify. Don't do as ambitiously, not as strong. But if it still hurts, just stop. One more time. Tighten and hold. Hold. Your thigh muscles get like soccer player muscles, big, bulky, and release them. Now we want to learn how to differentiate those muscles from the buttock muscles, because many people who start that mix or interfere, one muscle interfere with the other or co-contract at the same time, which is not necessary. This time, squeeze your right buttock muscle, not the thigh, but the right buttock, right cheek, contract it, and feel your pelvis will turn away to the left side. Then relax your buttock, let the pelvis settle back on the floor. You're contracting the buttock of the straight leg. Tighten it, feel, can it get firm? Can muscles underneath your tush get firm? Turning your pelvis toward your left thigh a little bit. And then release it, let the buttock settle. Again, contract one more time, the glute set. Contracting gluteus muscle isometrically. Hold it. And then release it, let it settle. Great. Next movement is straight leg raise. The leg that is long, the right leg, you lift it. You can put your hands down along the sides to brace yourself and lift your right straight leg toward the level of the other knee and lower it down. Not higher than that. Watch that the lower back will stay close to the floor and doesn't arch. You're not trying to pull your lower back off the floor as you're lifting or lowering the leg. Lift your leg is straight. It doesn't roll inward, it stays straight, or perhaps is rolled a little bit out, and then come back. Feel the muscles in the front of the thigh and the hip. One more time. As you exhale, lift, straight leg raise. And then come back. Your knees straight and come back. Wonderful. Now, bend your right knee and make the movement of straightening your right knee like a kicking movement. So it's not a straight leg raise anymore. You're starting with both knees bent and you straighten your right knee. Try not to move your thigh up or down. The thigh stays the same level as your left thigh. You straighten the leg, put the foot back to the floor, heel back to the floor, ball of the foot to the floor. Lift the foot off the floor, do the kicking movement to straighten the knee, and then bend it. Go one more time. Straighten your right knee. Again, don't turn the leg inward. Don't turn the thigh inward. Bend the knee, return to straight position. I mean, to bend position, to beginning position. Wonderful. Now we'll do the same sequence on the left side. Straighten your left leg. Keep your right knee bent. Arms are down along the sides. And we do the quad set. Remember that we differentiated between buttock and thigh muscles. This time you want the left thigh muscle to contract. Push the back of the knee into the floor or into the rolled towel if you use one. Hold it for a few seconds. Release it. Feel, can you do it without tightening your buttock? The differentiator is what happens with the left heel. If you're contracting the buttock, your heel is actually pushing into the ground. If you're contracting your quad, your heel may raise a millimeter. Like if I put a sheet of paper underneath your heel and you tighten your quad, your heel will go into the air or it will lighten up. Can you sense that? When you're tightening your left quad, your knee, there is normally a certain level of hyperextension of the knee, which is healthy, normal hyper. I'm not talking about hyperextension. If you have propensity for hyperextension, put a towel underneath your knee so it doesn't lock like that. Let's do it one more time. Contract your left quad, hold it for a few seconds, tight, contract it, contract it, contract it, and then release it. And then we do the left glute. So this time your thigh should be relaxed. Squeeze your left buttock muscle. Your pelvis should roll a little bit to the right. When the left buttock gets thick from the contraction, it will lift your pelvis on the left side, turning it to the right and then relaxing it. And be happy with approximations. If you're new to that, you might feel, oh, I'm confused. I don't know how to tighten my buttock. That's okay. Do your first approximation. Squeeze, hold it for a moment. Feel, did it turn toward your right thigh, your pelvis? And then relax it. Is it moving away from your thigh? Feel in here, your left heel actually pushes into the floor because buttock is the hip extensor, meaning it pushes the back of the thigh, back of the knee into the floor. Squeeze, left buttock, release it. For people who have trouble with that, a little cheat sheet could be straighten both of your legs and squeeze both of them. See if it's easier to squeeze both buttocks. Contract both of them, the pelvis will lift a little bit. Pubic bone will lift a little bit. Then relax them. Squeeze them, relax them. Squeeze them, relax them. Can you feel the pelvis responding? The lower back flattens a little bit. The pelvis, the pubic bone lifts toward the ceiling. Now, alternate. Contract right, contract left. Sometimes people, when they start to do one-sided movements, feel, oh, I cannot differentiate that. But we do that. You do that in walking. When we walk, it's one buttock contracts, the other contracts, one and the other. You don't contract both of them at the same time unless you really need to go to the bathroom, and then you contract everything to pinch them together. But normally it's one and then the other and one and the other. Great. Now bend both of your knees. Actually, no, the left leg only because we have the straight leg. So bend the right knee, left leg is straight. Right knee is bent, left leg is long, arms down along the sides. Your abdominals contract a little bit to stabilize the lower canister of your body, and you raise your left leg. If the leg is too heavy, make it just lighter. Don't raise it. For those of you who can raise it to the level of the the right knee, and then settle it back. The knee this time is straight. You lift straight leg and you lower the straight leg. You are not bending it. When the leg returns, you relax for a moment, and then you repeat it again. Feel the work of the hip flexors, the quadricep muscles, and also your abdominals. Lift and then lower. Fabulous. Bend your left knee, and we'll do the kicking movement, which is mainly your quadricep, that four heads of your thigh muscle in front. Straighten the left knee, bend it. So it's the kicking-like movement, but not aggressively. Straighten the leg, see if it comes to full extension, and then to come back to bent knee position the starting way. When you're doing this kicking movement, make sure the thigh doesn't turn inward, because then it's overusing the outside thigh muscles. Straighten. It's as if the inside heel led forward to the ceiling, and then bend. Wonderful. Next one, another buttocks and hamstring muscles, which is bridging. Put your arms down along the sides, both knees are bent, and you raise your pelvis up. For those of you who have troubles with lower back and don't like that movement, try to do it like one piece, so it's not sequential, one vertebra and the other. Others can do this sequentially, first lumbar vertebra, then thoracic, all the way up to your shoulders, and then returning one vertebra at a time until the pelvis, the buttocks kiss the floor and you return full weight to the ground. Let's do it a couple of more times. Again, none of the exercise should give you pain. If it does, just cross it out for now. You may try it again a week from now, 2 weeks from now. Raise your pelvis and feel your buttocks, how they contract. You could even touch when the pelvis lifts. Squeeze, touch with your hands your buttocks and feel. Can you feel how firm they are? And then return. Now we do the type of bridge that will recruit your hamstrings, back of the thigh muscles. Return your pelvis down, and now slide your right heel halfway long. Halfway. It's still bent knee, but not as much as the left one. And now lift your pelvis, but just halfway or quarter of the way that what you did before. Your right heel is pushing into the floor. Toes are up to the ceiling. And raise your pelvis just a smidge. Feel how the back of your right thigh is recruiting, and your left buttock. So the right leg is a little bit further away. That shifts recruitment to the hamstring muscles. Return. Some people who are new to this exercise may even feel cramping in the hamstrings. Then you need to change angle a little bit. Do less vigorously. Train yourself slowly so you don't get cramps in the back of your right thigh. Good enough. Let's now bring the right knee to chest. Put your hands on the knee, behind the knee, and do kicking movement to now stretch, to elongate your hamstring muscle. The one that was working just a moment ago, you're giving it an opportunity to lengthen. Straighten your leg and bend it. A little side note for those of you who are very experienced in this exercise program, see if with your hands you could grab the middle portion of your hamstring and stabilize it or pull it toward your buttocks while you do the kicking movements. This will elongate your hamstring tendons near the knee rather than near the buttock. This is much more important to create flexibility there at the knee than pulling it from the seat bone. And having your hands grabbing the tissues a little bit and pulling a little bit down while your leg straightens out may be an interesting tool that impacts those organs within tendons that are responsible for neurological changes in the tone of the muscles. Good enough. Now, return the foot down to the ground, hands down along the sides, and straighten your left leg halfway. Left leg halfway, heel is on the ground. The left foot can be flexed, dorsiflex, meaning toes are pointing to the ceiling, but heel is still standing. Right foot is close to your buttock, and go with a half or quarter bridge. And feel now it's the opposite hamstring, the left one that is working. The right one is close to your buttock. Left is further away. So make it asymmetrical. Right is closer to your buttock, left is further away, and do a little bit of a bridge and feel on the right side is your glute that contracts, and on the left side is your back of the thigh that fires. And then release it. Put the pelvis back down. Don't be ambitious. It doesn't pay to rush or force. And then let's lengthen that hamstring. Bring your left knee to chest and do a kicking motion. Back of your hands behind the knee, below the knee, or behind the knee on the thigh, and straighten your leg, bend it, straighten to the ceiling and bend it. Again, for those who are experienced, you can pull the tissues, soft tissues, including your muscles and tendons, toward your buttock while you straighten the leg. This creates this GTOs, Golgi tendon organs, to stop contraction of the hamstring, to yield, to release it. Good. Couple of extensions to lengthen the leg. Good enough. And then we do the 3 exercises for the buttocks, the gluteal muscles and hip abductors. So lie on your right side, please. And for some who don't have particularly strong or robust glutes, you might want to start with just 1. Don't do 3 in a row, because you may cause yourself a flare-up like with any muscle. So first one is clamshell. Both of your knees are bent. You're lying on your right side, and lift your left knee away from the right knee. Your left heel stays on your foot, on your right foot. And you open the clam to the ceiling and you close it. And feel muscles in the left buttock. Can you feel them contracting? You're lying on your right side. Don't roll on your back. Lie on your right side. And then you lift your left knee toward the ceiling while you remain on your side. You don't roll over. You remain on your side. So your left hip joint opens like a clam or like a frog leg outward. And then come back. Again, 3 times, plenty enough. Relax. For those of you who had enough, you feel that your buttock got tired already, don't continue. For others, the next progression is the fire hydrant, like the dog peeing. Lift the left leg straight up, your foot and knee toward the ceiling, and then come back. So now you're dealing with the whole length, weight of your leg. Lift the knee to the ceiling, externally rotating your hip. Not the foot, but lift the knee, and leg. Your leg is dangling, actually. Your foot is dangling close to the buttock as you open the knee to the ceiling, and then come back to the other knee. And you do this 3 times or so, and feel this is much more vigorous for your buttocks, for the hip abductors and rotators. Rest a moment. And for those of you who have enough power and can deliver repetitions after repetitions after repetitions without any flare-ups or setbacks, the next one are circles. You bring your left knee to chest, then bring it to the ceiling, then bring it away from your body toward the right knee, and then toward your chest again. And you make large circles in one direction. Large circles of the knee toward your chest, up to the ceiling or out to the ceiling, away from your head down, toward the right knee, toward the head again, toward the ceiling. Stop and rest a moment before we change direction. What you should feel is a nice burn in the buttock, but not overly contracted to the point of some spasms. And negative responses. Let's do a couple of circles in the opposite direction. Meaning the knee comes toward the head, then down to the right knee, away from the body, and then toward the ceiling. Toward the head, down to the right knee, away from the head, toward the ceiling, toward the head. One more time. And roll over onto the other side. And we'll repeat the 3 or just 1. Again, listen to yourself. The most important is to learn how to listen to yourself. Not to the teacher, but to listen to yourself, what your body can do. If you've been doing this exercise for now 6 weeks or 8 weeks, you probably have no troubles with it. If you do, you should reach out to us and let's figure it out. What's holding it? First one, clamshell. This time you're lying on the left side and your right knee is bending, lifting toward the ceiling and away. Lifting toward the ceiling and away. Leg is opening like a frog. The back stays pretty much. It will have tendency to roll over, but don't let it take over, because sometimes if you just roll over, you don't contract those buttock muscles sufficiently enough, and they're replaced by muscles of the trunk. So it should be hip, your knee moving away from the other side, but the chest is still facing forward, the wall in front of you. After you did a few times, rest for a moment. Second is lifting the whole leg, not the knee only, but lifting the knee, and the foot is dangling. Allow the foot to dangle, and you lift it toward the ceiling. Imagine dogs peeing on the hydrant, that opening of the leg outward, the whole leg, the knee, the foot, and then put the leg back down on the other leg. Feel the power in the right buttock now. Left buttock works too, because it has to push into the floor. Perfect. Rest a moment, and then next, the last, we're doing a couple of circles. Bring the knee to chest, bring the knee to the ceiling, bring the knee away from the chest, toward the other knee, the left knee, and then to the chest again. And foot again here is dangling. Don't straighten the whole long leg like a log. The knee should be bent, and you painting the circle with your knee. That's right. Feel the work in the buttock. Doesn't have to be huge movement. Make it precise and change direction. Rest a moment, 10 seconds rest, and then 3 circles in the opposite direction. Terrific. Leave it alone. Lie on your back, please. So this was the circuit, the knee circuit. This is what people were talking about. For those of you who've never done it before, there you have it. It's part of the Outstanding Knees program. And this is like the lowest hanging fruit to practice.